Hello, my name is Denver Dobson, and I'm a senior in the exercise science program at Idaho State University. The title of my research is Understanding the Barriers That Limit the Hispanic Population from Receiving Healthcare, a Qualitative Study. I was interested in researching this topic because I aspire to become a rural healthcare physician. I was able to live in northern Argentina for 2 years, where I was able to witness firsthand the effects that a lack of adequate healthcare can have on the community. Upon returning to the States, I wondered if rural Hispanic communities within the US encountered similar healthcare challenges. As I have researched this further, I have become aware of core healthcare barriers that are not commonly addressed in healthcare today. According to the US Census Bureau, it is estimated that in 2019, 60.5 million Hispanics, or 18.5% of the overall population, live in the US. Providing proper healthcare to the Hispanic population, especially in rural communities, is a growing challenge facing the modern healthcare system today. Many barriers create healthcare disparities for the growing Hispanic population in the US. And although there are many studies about the barriers to the Hispanic healthcare, the impact of traditional beliefs is a barrier that has not been widely examined. The purpose of this research study was to identify barriers and cultural beliefs that need to be addressed to eliminate discrepancies in healthcare for the Hispanic population within the US. To investigate this, we designed a qualitative research study in order to understand the prevalence and impact of these barriers pertaining to the healthcare of the Hispanic population in our area. This process involved receiving ISU Institutional Review Board approval and designing a 5-question semi-structured interview that was used to interview 3 local healthcare providers who have experience working with the local Hispanic community. During my research and interviews with the participants, 3 central barriers arose: trust, language, and social determinants of health. Prior research has investigated the latter, but the emphasis of this research study was to investigate how traditional values and beliefs can create a barrier in healthcare if not understood, which best falls under the trust barrier category. All participants agreed that trust is a major barrier to the Hispanic healthcare. Participant 1 said, "You have to gain trust in whatever disenfranchised group you're dealing with. It's going to take time, but that's where you've got to start." Additionally, research performed by Florinda showed trust and respect are core Hispanic cultural beliefs. The interviews made it evident that the difficulty and unknown about the healthcare system creates fear and uncertainty for the Hispanic patients if they do not have someone within the system they feel they can trust. Additionally, participant 2 also highlighted this point, saying to gain trust, we need to go out to the communities, churches, and schools to meet them in an environment that is comfortable to them. This way, we can create a team with our patients. The next barrier is the language barrier. A common practice in healthcare to address this is by using interpreters, but this does not eliminate the barrier as some may think. Participant 2 addressed a major barrier that by the fact of what you're doing, it doubles the length of the visit, as everything needs to be relayed back and forth. The interview suggested this may lead to more superficial conversations and prevent the patient from expressing themselves. All participants agreed that by trying to address this language barrier in the best way possible, it will also help eliminate the trust barrier as well. Lastly, the barrier of social determinants of health is a major barrier that was not the major focus of this study. However, all participants mentioned how financial limitations, lack of insurance, lack of documentation, and lack of transportation create major barriers for many Hispanic patients. Cultural awareness is key to understanding these healthcare barriers. Participant 3 highlighted this with an example of how many forms that are healthcare forms in Spanish are not updated when the other forms are updated, and the old Spanish copies that are no longer relevant continue to be used, which creates a lot of confusion for Hispanic patients. So based on the results of these interviews, I was able to pinpoint 3 potential solutions to accommodate traditional Hispanic healthcare. The first solution is learning the language. Participant 2 stated, if you can just learn 2 to 3 simple phrases, I think it really shows respect. Participant 1 suggested that we implement Spanish into the education curriculum as is done in most countries around the world. And if learning the language just isn't a possibility, having interpreters that aren't family members are present during the visits shows the individual that you really value what they're saying and allows healthcare professionals to better treat their patients. Another solution is rural community healthcare education programs, which would help Hispanic individuals gain trust for healthcare providers and additionally help communities understand common misconceptions about the healthcare system and learn how to navigate it. Along with this, I believe cultural education and training for healthcare professionals should also be used. As healthcare professionals work to improve their knowledge of the cultural beliefs of their patients, patient-doctor relations will improve, resulting in more of the Hispanic community seeking out and trusting professional healthcare providers. By implementing these solutions, Hispanic patients will receive better healthcare as they realize that they do not have to battle all these healthcare barriers alone. Thank you for taking the time to watch my presentation. I look forward to any questions or feedback.